Hello, today let's talk about review of other systems. There are generally like 7 systems in the human body, and the other systems you might already done it or done them on your HPI or the history of presenting illness. So the rest you need to review them in the section of reviewing of other systems in your history. So these statements they show the importance of review of other systems. The review of other system is generally meant to check the health of the patient, any weakness if the patient is having, appetite changes, weight changes, if the patient is having fever, and the general well-being of the patient. Apart from the system which is being involved or the system which has the illness, but you need to check the other system if they are okay. So generally it's to check these points. So let's start with the cardiovascular system. So in cardiovascular system, you ask questions like, do you experiencing any dyspnea, which means shortness of breath? Literally, you need to ask the patient directly, do you have shortness of breath? And when you are recording, you might record it like as dyspnea, or you might record it as shortness of breath. Other chiefs they don't mind. You can write just dyspnea, and they don't mind. So you need to inquire further that shortness of breath, is it during the at rest or during exercise? Other question is like orthopnea, which means shortness of breath on lying flat, and does the patient needs pillow in order to sleep? Another one is paroxysmal nocturnal dyspnea, and this is a type of dyspnea whereby the person wakes up at night searching for air. Other times they call it air hunger at night. Another thing is you need to ask about any swelling on the ankle or the legs. That is called edema. The other question is you need to inquire about any chest pain the patient is having and awareness of heartbeat. And lastly, you need to ask about any dizziness or loss of consciousness. Moving forward to respiratory system, you need to ask about any wheezing, if the patient is producing a musical sound, eh, which means there is an obstruction or there is narrowing of the lower respiratory tract, and also dyspnea. You need to ask about cough if the patient is coughing, and is it productive or unproductive? And if it is productive, you need to ask about the color of the sputum, amount, is it purulent, and does it smell? The other thing you need to ask is about if the patient is coughing blood, and also chest pain, and last you need to ask about night sweats. Moving forward to gastrointestinal system, you need to ask the patient about if there is any changes of appetite or weight. Also, difficulty swallowing, so you need to ask about that, which is called dysphagia. You need to ask the patient if he's passing air via mouth or via the anus frequently, which means there is accumulation of gas in the stomach due to various reasons. Also, you need to ask the patient if he or she experiencing a burning pain behind the sternum, which might indicate peptic ulcer disease, that is called heartburn or indigestion, the burning pain retrosternally. Also, you need to ask if the patient has been vomiting blood, that is called the hematemesis, or just vomiting anything other than blood. Another thing you need to ask is about abdominal pain or discomfort. In the bowel, you need to ask about any changes in the bowel habit. You need to ask about diarrhea if the patient has been diarrheaing recently, and diarrhea means that the patient is passing loose bowel or loose stool more than 3 times per day, or 3 times or more per day. If it is less than 3 times, that is not diarrhea, that is something else. Also, you can inquire about yellowish discoloration of the eyes and the skin, that is called jaundice. This can be done under the physical examination, or sometimes the patient can tell you her or himself, because someone might notice at their home, like the person is having a yellowish discoloration. Another thing you need to ask about if the patient has been passing bloody stool, uh, or just spots of dark spots, bloody spots on the stool, that is called melena. Blackish or black tarry stool, they call it. That is melena. It's an indication of a lower GI bleeding. Moving forward to genitourinary system, you need to ask the question like, are you passing? Do you have difficulty or pain during urination? That is called dysuria. Those are called the lower urinary tract symptoms. The roots, there's a dysuria frequency, which means increased the urination during the day or during the night. Nocturia, increased urination during the night. eh, or hematuria, which is passing blood in the urine. These these symptoms occur in disorders which affect the genitourinary system. The person might be having infection, or the person might be having maybe tumors. Another system which is being forgotten most of the time is reticuloendothelial system. This system consists of monocytes and lymphocytes. Also, the organs which are involved in this system includes the liver and the spleen. So here we want to check about anemia, low platelets, low white blood cells, lymph node enlargement in this system. So in anemia, you need to ask about weakness or tiredness, dizziness or shortness of breath the person is experiencing. For the low platelets, you need to ask about bleeding tendencies or bruising easily. If the person is having low white blood cells, is having low white blood cells, or vice versa, the person might be experiencing fever, infection, the person might be having chills or shakes. If the lymph nodes are enlarged, the patient will be having the sensation of swelling or lumps under the arms or in the groins. So you need to ask things like this. But also you can do physical examination and find out. In the locomotor system, we check if the system which is involved in the movement, the muscles, the joints, and the bones, if they are okay. So if the patient is having arthritis, the patient will experience painful or stiff joints. So you also need to ask about swollen joint. If the patient is having swollen joints, it might be a synovitis or effusions. You also need to ask to check for spinal disorders. So you ask about pain, pain in the neck or pain at the back. You also need to ask the patient if he has difficulty walking or difficulty in self-caring. The patient might have all disability. And lastly, about the nervous system, you need to ask about headaches or pain in anywhere on the body. You need to inquire about the power of the patient. So you ask about any weakness or loss of power in the limbs of the patient. Sensory system also need to inquire. So you ask the patient if he or she is experiencing any loss of feeling or sensation in limbs or body, any loss of sensation. You need to ask also about if the patient has been experiencing dizziness recently or loss of consciousness. That's that is how we assess the consciousness of the patient. Or incontinence. Here you ask if the patient has been experiencing a urinary urgency. The patient has difficulty in holding back the urine. And lastly, you need to inquire about the vision and hearing properties of the patient. If there is any hearing loss or there is a visual loss.